So welcome to Transform Gov, where we share real-life stories about technology and data and how they're changing how our public services are delivered and designed. As always, we talk to those who are on the ground, actually implementing transformation in our government. Transform Gov is part of the Ireland e-Government Awards, and it's brought to you in association with Accenture. I'm Maeve Kneafsey. So today on Transform Gov, I'm joined by Stephen McPeake, founder of Civic Dollars, whose West Belfast project was a 2024 Ireland e-Government Award finalist. Civic Dollars is a homegrown digital platform and rewards people for spending time outdoors, improving their health and supporting local businesses and communities. Stephen, you're very welcome to Transform Gov.
Hi, Maeve. Thanks very much for having me.
So for somebody in local government, Stephen, who has, maybe they're working within health or they could be in a local authority, what is Civic Dollars? And just tell us simply and practically what it is.
Yeah, sure. It couldn't be more simple that you earn a community currency for spending time outdoors. So to take you back, whenever we designed it initially, we were looking at ways to encourage people to spend time outdoors, to get more active, and particularly those who were inactive. So we wanted to give them that encouragement to get off their sofas and just spend some time outdoors, because a lot of our research was showing that it was people who were living sedentary lifestyles and being inactive were the biggest cause of non-communicable diseases like obesity, type 2 diabetes, heart conditions. So it was very important to target that demographic and not just reward those people who could do 10,000 steps a day or could do the couch to 5Ks and cycle and swim, etc. So yes, we don't mind if you can do that, but we wanted to encourage those who couldn't do it. So get those who were inactive more active. And a very simple concept is that we didn't reward you for how many steps you've done or how far you ran or how far you cycled. We wanted to just reward you for spending time outdoors. So the idea was that you earned one civic dollar for every 30 minutes that you spend outdoors in parks, open spaces, greenways, beaches, forests in your region. They'll accumulate in your digital wallet and on our app, and then you can avail of rewards from local businesses, from public transport, from leisure centre access.
Just before we get into all of that, how does encouraging people to walk outdoors actually end up benefiting the community? I mean, there's a mix, isn't there? I mean, most of us have sedentary lives, right?
Yeah, absolutely. And especially since COVID, a lot of people stopped moving and didn't start again afterwards. So the benefit to the community was that not only could you spend your civic dollars on rewards for yourself, but the big push for us was for community groups, that you were able to donate your civic dollars to local charities and community organizations, with the benefit to them being that they seen a separate set of rewards from the larger corporates in the area, so they could get access to skills and expertise from their employee base. So they could get tech support, marketing help. We now have cybersecurity training and accreditation for their staff, or legal and financial help from that internal knowledge base that those corporates have. And it just takes time and expertise of those volunteers to give back to the groups. And it's skills that they've never been able to access or afford. So you're opening up that whole connection between corporate and social as well. And we give the corporates access to a social impact dashboard. So that helps their social impact measurements and corporate social responsibility reports at the end of the year as well.
So I suppose, just to get this right, so let's say I'm participating, let's pretend I'm a community group, and we decide to walk together and become part of the Civic Dollar mechanism or platform. And then we might pool all of our Civic Dollars earned from our time outside, walking or whatever it is, and then use that to buy services. Is that what you're saying?
Yeah, that's right. So it goes to the individual wallet, and then they can decide whether to buy something for themselves or donate it to that specific group that you mentioned. Mm-hmm. The group then get access to our portal where they can see that separate set of rewards that are unique to the groups and organizations.
And typically, what do people, tend to buy?
The most popular one was the public transport vouchers that we had in Belfast, which give you a full day of travel around the city on either the metro or the glider system. In Donegal, you can get access to discount from Michael Murphy Sports, which is very popular, or we've had cafes that give us discounts to the coffees, and we actually have some of free coffees available in some of the cafes as well. But then some of the unique ones is the likes of the 2-for-1 surf lessons in Bundoran. In the Dublin project, we had Teeling Whiskey Distillery had gave us 2-for-1 entry to their distillery tour, which is, yes, it's alcohol involved, but you're offsetting that with the amount of steps you do around the tour. And it's also to look at that heritage and tourism aspect of the project, that we can encourage tourists, visitors, to spend more time and visit parts of the city that they normally wouldn't access.
So how many people have signed up and actually are earning Civic Dollars since you started the business?
Yeah, since we started, we've almost 8,000 registered users on the platform, and it's nice that it doesn't matter where you earn your Civic Dollars, you can spend them anywhere. So you could earn them in Donegal, spend them in Waterford or Dublin or Copenhagen or Myrtle Beach in the States. And the same, you can earn them anywhere, spend them anywhere, and donate them anywhere. So yeah, we're having a big peak of activity at the moment because of the Innovate UK project that we're running up in Derry and Strabane District Council, where our remit is to target people who are pre-diabetic or at risk of diabetes. Those people who join the program, they can get access to extra rewards. So there's an even greater incentive for them to spend time outdoors, and they can get access to a load of free coffees and bowling vouchers, cinema vouchers, and holistic courses on well-being, armchair aerobics, yoga, Pilates, circuits classes, things to try and education as well, sort of to improve the health literacy, to help them understand why they are at risk of diabetes and how to try and stop it.
And tell me, who are you doing that in conjunction with?
Yeah, so that's working in partnership with Developing Healthy Communities, which is a social enterprise based in Derry City. And they've done great work over the last number of years in the city, trying to improve health and wellbeing through a number of courses. But we went in with them for a tender with Innovate UK, which is focused on letting social enterprises test out technology like Civic Dollars to try and see how it can integrate with what they're doing. And it's been fantastic that with that award, they were able to recruit 3 people to run the project in Derry and Strabane, and we've just hit all our milestones, and we've been allowed to scale it out now into the entire Western Health Trust, which incorporates Fermanagh, Omagh, and a bit of Causeway Coast and Glens as well. So we're able to expand what we've done in Derry and Strabane, copy and paste it into those other areas, and try and hit even more people that are at risk of diabetes, of type 2 diabetes.
Who are the, I suppose, the champions within the community who spread the word for you?
Yeah, it's working with those community leaders that are mainly working with and especially in that deprived area in Derry and Strabane. That Foyle region is
Would it be
historically known as.
GPs or?
Yeah, we're working with the GP Federation, and we just had a big meeting with GPs yesterday that have already identified a cohort of people over the last number of years that have been diagnosed with prediabetes. And unfortunately, what they've seen over the last number of years, in 2024, they've seen that of everyone that they treated for or tested for that were pre-diabetic, that 50% of them have went on to develop type 2 diabetes. So it's a huge issue in the area. So it's been led by the GPs, by the community leaders as well. So there's a load of health initiatives and the health-based community groups in the area. So we're working with their leaders and sort of training the trainer, and they're helping us push out the message.
You know, one of the things I think that you probably everybody notices now, that when you go to your doctor, you're involved in any sort of health, you notice there's just so much information and so much, opportunities, I suppose, but you can get overwhelmed. So do you have any sort of secret sauce in terms of why you think people are responding to your particular solution, your way of dealing with things, earning Civic Dollars?
Yeah, it's something that's unique. And a lot of the research that we looked at before is that generally what GPs could do was write a 6-week prescription to a leisure centre, or membership to a leisure centre, or membership to a gym. And anyone that was living with obesity or was at that stage of pre-diabetics or pre-diabetes, they didn't feel comfortable going to a gym or going to a leisure centre. But because we're just trying to encourage them to spend time outdoors, and they can go and sit at a park bench if they want to and still earn Civic Dollars and take part in the project. So we try to be as inclusive as possible. And then it's the incentive of the reward as well. Like, there's no point me suggesting what they would like as a reward. So we do a lot of focus groups and visits out to the community workshops, and we take the feedback to see what they would like as a reward. And then we work with the budget that we have with us this program and try and fit it as best we can to their needs.
And what outcomes have you seen so far for people, your champions, I suppose, councils and health organisations?
Yeah, like a prime example is the research that was done for the Healthy Aging project in Belfast, which again is one of the most deprived areas in the UK, the Upper Springfield area, and working with a social enterprise there as well. The older people in that region earned over 18.5, spent over 18,500 hours earning Civic Dollars throughout the project, and redeemed over 1,500 rewards throughout. But there was that encouragement if they would get 5 Civic Dollars every time they filled out one of this health and wellbeing surveys. So we had a baseline measurement, 2 midpoint measurements, and an endpoint measurement as well, which showed a 12.8% increase in their self-reported health and wellbeing throughout the program. So it had tremendous impact, and especially in that older generation that was taking part in the program.
And why do you think this kind of mechanism works better than maybe campaigns or kind of awareness messaging?
Yeah, it's hard to know. I suppose it's something unique. And whenever we first looked at Civic Dollars, we decided that we'd go community first, that we'd start at a very low level and work with the community organisations, look at rewards for them, and build on their advice from it. And as we've seen before, especially since COVID, everybody's sort of become very anti-authoritarian. So if the government or if the councils or if the health service said you must spend more time outdoors, there'd be a barrier there that they'd say, I don't think we will.
Yeah, it's like a nanny state. Don't be telling me what to do.
Exactly, yeah. But whenever it comes from such a low level from their peers in the communities and the charities, they're asking them, right, spend time outdoors, give your Civic Dollars back to us because we need our computers fixed, or we need tech support, marketing advice, legal help from the larger corporates. It's like, yes, okay, we'll do that. And we've seen that still between 40 and 40% of all the Civic Dollars that have been earned have been donated back to the charities and community organisations. So we know there is that want in people, that they don't particularly want to keep the Civic Dollars themselves, that they want to give it back into the community. There's not as much cash about anymore for people to donate to those organisations, but there's time that people can spend outdoors and donate to those deserving groups.
It's a no-brainer, right? Well, look, I have to take a very short break. We're going to pause to share a message from our partners, Accenture, but don't go away. We'll be back in a moment.
Through the power of cloud, data and AI, Accenture is helping the public sector by blending human ingenuity, technology and a delivery-focused culture to turn their ambitions into action. Be ready for any challenge by adopting a continuous reinvention mindset to deliver human-centric services that adapt and grow with your needs. Contact the team at Accenture to find out more.
So we're back for the next part of our conversation with Stephen McPeake from Civic Dollars, who's been telling us all about his wonderful platform that's getting people out in the air, but also donating what we call Civic Dollars back into the community. So in terms of the platforms your platform, why do you think it's important to link it to local, parks and beaches and neighbourhoods?
I think that's where people spend most time, and an example would be the project in Donegal. So they were early adopters in Ireland through the Healthy Ireland and Sláinte Care programs, and Margaret Fitzgerald was the Healthy Donegal coordinator up there, seen what we were doing through the various projects in Belfast and Dublin and Derry, and she was just, yes, this would be perfect for Donegal, especially with the amount of parks and open spaces that they have up there. So we started off with a pilot just with 5 parks, one in each of the municipal districts in Donegal. And after 6 months, then we were lucky enough to be awarded a 2-year contract with Donegal. And now we have just over 120 zones throughout the county where you can earn Civic Dollars from the beaches and around Bundoran, up around that Rogie Walkway, right up to Buncrana and Malin Head and Slieve League Parks. So it's a great area, great big wide area. And I know people usually say it's underutilized, but not from what we've seen. The users in Donegal have now spent just over 16,000 hours outdoors earning Civic Dollars in the area. So it's brilliant to see that. And people we take advice from them that they say, oh, we would like our park involved in it. So if we haven't zoned out any particular areas, we take feedback from the users and from the communities to say, oh, we would like this play park added, we would like this zone, this pitch added. Even the GAA and soccer pitches and club grounds, we can geofence around them. and we can now set them as auto-donate zones. So any Civic Dollars earned in those areas could be automatically donated back to the club as well, which is something we're working on with Derry City, Waterford, and the guys in Donegal as well.
What's been the biggest challenge for you and the team in terms of just winning those pilots and, of course, going beyond the pilots?
Yeah, that's always the problem for any sort of startup. You get stuck in that death by pilot setup. that yes, you can apply for as many innovation grants and pilot projects that you want or that you can, but unless there is a route to procurement, it's very tough to get any sort of feet in the ground and get it extended. So we experienced that ourselves in Belfast, where we went in phase 1 and phase 2 of that Amazing Spaces project, which was great. The data come off it was fantastic. But there was no phase 3, there was no route to procurement to the city after that. And we fell flat on our faces in a few other council areas in Northern Ireland, to the extent that we sort of turned our back and said, no, we have to focus in places that want adoption of health-based technology and of smart cities technology and GovTech. So that's why we went with Donegal and Waterford have been great. We're launching in Meath in March as well, which is great to get another one signed up in the Republic. But also our projects in Copenhagen.
Just to let people know, sorry, before we talk about Copenhagen, which is fascinating, the people that you're working with, is it local authorities in most cases, county councils, city councils?
Yeah, with our project in Derry and Strabane, we've sort of bypassed the council as it was funded from Innovate UK. And because there's no hardware required, we're working with the social enterprise. So it became a council-supported project, not a council-funded one. In the Republic of Ireland, we're working with the Healthy Ireland and Sláinte Care teams to fund the projects in the various councils that we're working with there, or counties that we're working with down south. So it's funded through those programs, the Healthy Ireland and Sláinte Care programs.
And I know that we had an interview with Lou O'Hare from Sláinte Care, and I know that they are looking at that whole problem from pilot to actually getting into live ongoing programs as part of the Sláinte Care Innovation Fund. So that's something yourself and everybody else who's interested should look at, because they really are trying to fast track pilots into real ongoing services.
Stuff, yeah.
But talk to us about Copenhagen.
There is some fantastic health tech right across Ireland, not just ourselves, but a lot of the other ones that, again, are stuck in the same sort of rut that we were, that, yes, they got the pilot stage, and how do they take that next step? And the amount of ones that have had to go outside of Ireland, UK, outside of Europe even, to prove their case, and then they have to come back in and say, look, yes, we've been successful in the Middle East, in Australia, in the States, and then they have to charge them 10 times what they were going to get it for earlier on, because they've already proved the case outside of here.
And I suppose to give comfort to the system, one is that SIF are trying to really deal with that problem, but two, you've already gone through all the procurement hoops that you have to satisfy, right, a lot of the council. So I presume that's enabling you to speed up your engagement and hopefully move beyond pilots, or is that a dream?
Yeah, no, it's made it very easy. So yeah, right at the start, whenever we had the Smart City project in Belfast and the Smart D8 project in Dublin, the amount of GDPR and privacy and terms and conditions and everything that we had to go through was an absolute pain at that stage. But it's really held us in good stead that we were able to copy and paste that in the other locations and say, yes, we're GDPR compliant. Here's our privacy or terms and conditions with our vendors or users or groups. So it's made it really easy. And then working outside of here, routine working with the hospitals in Copenhagen, the pharmacological companies, and even in the States, working with the cities, getting approval from them, that it's great to have that stamp to say, yes, it's been approved by this city in the States or this city in Denmark. So we know it's GDPR and covers all those bases that is usually a barrier to get access to councils and authorities.
And so tell us about what's been going on in Copenhagen and with the pharma company that you've been doing some work with.
Yeah, sure. We were very lucky to partner with Novo Nordisk in Copenhagen. So yes, everybody knows them from producing insulin and the weight loss jabs, but not a lot of people know that they have an absolutely huge social wing called Cities for Better Health, which is running live in 60 cities across the world. And they're doing amazing work from the COPE project, which was treating childhood obesity in various countries across the world, right through to helping women and girls get back into soccer in South America. So each city and each continent have different projects running. And we've been very lucky to be working working in their backyard in Copenhagen with the project there to help rebuild the communities in the Jernbaneborg, which is the old railway district in Copenhagen, where they're rebuilding the entire region and creating a community. So they want to create a community first and get people in to start using it, and avail of all the services that they have in there, trading the Civic Dollars for access to free meals, to sports clubs for the kids, to basketball courts, soccer courts. And now we've just been extended into next year. So it's great that we're starting to scale out there into the other regions within Copenhagen, and we've a project meeting with them now in February. So yeah.
And just tell me why for them is it such a positive? What are the outcomes that you've produced for them that has made them want to continue with you, and possibly, because I think you mentioned before when we were preparing for the interview that they're in 60 different cities. So what is it you deliver that satisfied, I suppose, their vision?
Yeah, I think it was something unique that a lot of the other sort of reward-based systems were reliant on you doing an activity. So you had the likes of Sweatcoin and Fitcoin and Better Points, even Strava and Garmin, their reward system all reward you for doing certain activities, and it wasn't very inclusive. So whenever they seen what we were doing, yes, there's a lot of data in the back end that gets collected and anonymized and aggregated, of course, and that's one thing that we're very clear about, that we don't sell any of that data to anyone, that we provide actionable insights for the governments or for the councils that we work with. So there's no individual or data that's sold to them.
Yes,
which is very key. But what
trends,
I think
they can see trends, and you know, for example, I'm dying to ask you. I kept forgetting to ask you, what's the profile typically of people who participate in Civic Dollars? I mean, are we talking a particular age group, a typical demographic, a gender?
Yeah, it's been 40 plus has been the higher usage of it. Even, I suppose, because we were dealing with healthy aging projects, and that was a big older demographic, so that sort of tweaked the numbers for it. But yeah, we're seeing a hell of a lot of people, sort of middle aged to elderly, that are using it, which is great to see that they can use the technology side of it. But yeah, that's the kind of demographic, and we're thinking that's because people maybe have a bit more time at that age, and whenever you're below 40, that people don't have as much time, that they're always busy with kids or sport or some of the other fun stuff that you can do when you're younger.
I think they're still busy in their 40s. Maybe they're just a little bit more community aware, right?
Very possible, very possible. Yes, so it's been amazing to work with the guys in Copenhagen and see the impact that it's had over there, and now very excited to see what's going to happen with over the next year with the extension of the project there. And they've also been kind enough to introduce us to their other teams in South America, in the States, and in Indonesia as well. So because there's no hardware to install for Civic Dollars, it's very easy for us to scale and go live in certain areas. There's a few of them that I haven't even been to yet, that we're live in. So it's all about that team on the ground that are doing the heavy lifting for me.
And just on a practical level, has there been some sort of, did you mention to me there's some sort of agreement with local councils here where they can avail of your platform at a discounted price?
Yeah, that's one of the things we've done with the Healthy Ireland teams. Whenever we met them, that I like the idea of early adopters, especially in Ireland, whenever there is such a great community spirit in most cities and counties. So whenever we've done a deal with the Healthy Ireland team, that they can avail of a discounted rate, especially as there's so many of them signing up at the moment. So we've proposals with 4 other other counties at the minute, as well as the ones that we've already signed up. So we're hoping that, ideally we'd love to get them all signed up.
What kind of cost would it be for a year for the platform?
We were doing it for about €20,000 per county.
Okay, and then
with the deal that we done.
Oh, very good. That's excellent. And tell me about if you're thinking of getting involved, what kind of burden is there, I suppose, in terms of the internal team?
Very little. Yes, we want the internal team to work with us, but you're only talking maybe a few hours every week of the admin side of it, and pushing out the message for us. That's one of the things that we like, the social media side of it and the actual outreach into the communities. If we get speaking to the umbrella groups of the Chamber of Commerce or the umbrella community organisations, once we speak to them and explain the system and how we were able to replicate it from the other zones, it sort of makes sense very easily to a lot of them, and they're usually queuing to get signed up then after that.
Oh, that's brilliant. So I presume you have seen there's some indication of uplift of local business as a result of it.
Yeah, we want to push footfall, and we're sort of very unique that way, that we look to the local businesses to put rewards onto the system as opposed to the larger chain stores, to try and drive footfall for them. We've actually just created a campaign. We've been awarded funding to pay for some of the rewards and some of the projects that we're working with. So that's give us funding to buy vouchers in the local, sort of locally owned sports stores in Waterford and Donegal that we're going to replicate through the other projects. So we've Alfie Hale Sports in Waterford. We've got money in place to buy £40 gift vouchers there, and also Michael Murphy Sports in Letterkenny. So we have an option on the app that you can buy entry to that draw for 5 Civic Dollars, which is 2.5 hours spent outdoors. And then at the end of each month, we'll do the draw for the vouchers to drive people into that store as well.
So if the local authorities want to get, or councils or city councils want to get in touch with you, or the LGMA, how will they find out more? I mean, you've got a website, obviously, but what else? How else could they get in touch with you?
Through every medium. We're at Civic Dollars, so Instagram, Facebook, Twitter /X, LinkedIn.
Civicdollars.com, right?
And civicdollars.com is the website.
Mm-hmm.
So yeah, feel free to get in touch.
Stephen, look, thank you so much for joining us. It sounds like you were really at an exciting time for the work you've been doing. And I think when we spoke earlier, you mentioned that there's some possibility of a big deal in the USA. Is that correct?
Yeah, that's right. We're already live with our first project in the city of Myrtle Beach in South Carolina, which has been brilliant to deal with the team out there. I was out last year to meet the mayor and do the launch, and now we have a couple of really big projects in lined up that we can't say anything about yet. But yeah, we'll keep you posted.
Well, good. I think it's just a good indication of what a brilliant idea it is. Look, finally, thank you, Stephen. I really appreciate you joining us. And before I go, I'm just going to thank my team here. So thank you to the studio manager, Peter Rice, as always, video editor, Neil Horner, sound engineer and videographer today, Lee Brennan. Thanks for listening. And thank you, Stephen, for joining us on Transform Gov.
Thanks very much, Maeve.